welcome to Medgate today. Today we are at Apollo Hospitals and we have Dr. Kalpana Nagpal ma'am. Hello ma'am.
Hi.
So ma'am, we have a few questions for you. What inspired you to specialize in ENT and particularly in endoscopic and robotic ENT surgeries?
Okay, well, initially when I finished medicine and internship, I wanted to take a surgical specialty. And somehow I developed interest in ENT surgery. I wanted to either take up ENT surgery or general surgery. But I thought general surgery, then you need to further specialize, whereas ENT surgery is already a specialized branch. Few females when I took it up. So I thought it will be good if a female surgeon starts ENT, and ENT surgeries don't take too long. So, it's good that way. We're more comfortable. We finish our work by 6 p.m. So that's one of the reasons. And to specialize well, every branch, once you take up, you have to super specialize. You have to make a name. There's a lot of competition, and it's always important to upgrade ourselves. So I went for specialized training for endoscopic surgery in Savannah, Georgia, and for robotic surgery in south of Korea.
So ma'am, what role does technology play in diagnosing and managing ENT disorders today?
Without technology, medicine would have been very, very laid back. Technology has helped us improve a lot, both in diagnostics and treatment. In treatments now, with all these improved technology and integrated technology, we're able to do very complicated surgeries, and also surgeries where you reach inaccessible areas with minimal access, which means most of our surgeries are minimal access surgeries. Our incisions are very small, cuts are very small, and it's mostly keyhole surgery, and you can reach distant areas and inaccessible areas through these devices, and so technology has helped us a lot.
And ma'am, what are some common ENT issues people tend to ignore until they become serious?
In fact, most ENT issues people present very late, because most lesions are painless. Whether you talk about rhinosporidosis in the nose, patient has occasional bleeding from the nose and blockage in the nose. Similarly, fungal sinusitis, patient doesn't present unless there are complications, like swelling of the eye or severe headache or any other complication involving the orbit or the skull base. The patients don't come, whereas sinusitis, if it is ignored, there are a lot of complications. Similarly, ulcers in the mouth, most of them are painless. So if there's no pain, patient doesn't come to the hospital. And painless ulcers are more sinister. They could be malignancy also. Similarly, hoarseness, hoarseness should not be ignored if it is more than 2 weeks. They could be malignancy of the vocal cords. Like that, there are several lesions, even in the ear. Patients can have discharge in the ear for many, many years. They don't come. Whereas there can be complications like involvement of facial nerve. There can be vertigo, which is because of involvement of the labyrinth. Or there can be complications again in the temporal lobe because of the CSOM. So patients have to get their diagnosis timely. Similarly, snoring and sleep apnea. People think snoring is a good sign, whereas it's a myth. Snoring is associated with sleep apnea, again, which is a critical disorder. It can be root cause for brain strokes and heart attacks, cancers, etc. So timely diagnosis is very important.
And ma'am, as a leading female surgeon in India, what challenges have you faced and overcome in this field?
Well, that's a good question. In fact, in order to prevent the challenges that I have, and prevent the juniors having similar challenges, I started an association called Women Association of Otolaryngologists of India. We are more than 2,000 members, and the main goal is to help the juniors, to get them trained, as well as to help them practice, and to guide them. We give suggestions as to start group practices at an early age, so that their life is comfortable, they don't stress enough. And also for medical legal issues, it's always better to have a group practice. And for many other reasons, when we started off, there was not enough surgical training. We mostly learned surgeries just by observation. That was unfortunate. And now there are more and more cadaveric workshops that we conduct, where children, the juniors, are able to learn on the cadavers, and they can do better surgeries. And So we are actually wanting to be good mentors, and the challenges that I had initially, well, first of all, acceptance in the department. It was a male dominating department. I was the only female when I joined 20 years ago. Initially, there was this repulsion, why is she joining and all that. So now things have changed. Now there are many women joining otolaryngology. So I'm happy to help them, and we want this association to do a lot of things for this future.
Ma'am, one message would you like to give to the young woman pursuing a career in medicine and surgery?
Yes, one is take care of yourself at all times. Be sure you're safe. That's very important. Medicine and surgery will go on. Once you have accepted and you've joined this field, you know the challenges. You will be having to work hard. You will have to be showing empathy to patients. But at the same time, make sure your communication is good with the patient at every stage of treatment. Your communication with the patient and attendants is very important. Otherwise, the anxiety rises amongst the patient and attendants. And sometimes, the doctors are facing abuses. So it's always important, if there is clear communication, that at the beginning itself you tell them that this is very high risk, or the patient is suffering a severe complication. You can tell them this, even chances of death in case it is there. So you tell them everything. When you get a high risk consent signed for a surgery, you have to tell them all the complications on the table also. So make sure you're safe. Make sure you take proper consent before surgery or before any procedure. This is really very important, and get yourself insured. Professional insurance is very important. Indemnity bond.
Thank you, ma'am. Thank you so much for your valuable time. So that was Dr. Kalpana. Thank you, ma'am. Thank you, viewers.